Hi everybody, here today I have Julia. She's a patient of mine at Ocean Chiropractic Center. She's been under my care for about a month, and what you see before you is just the series of medications she was actually given over the past 6 or 7 months after a fall, right, in the bathtub. And I'm going to just give Julia the next couple minutes. She's going to talk to you about what's happened the past month while she's been under care in the office and about what the past 6 months has been like.
Hi everyone. Again, my name is Julia, and I've been coming here to Dr. Kayla's office for about a month. And I want you to just stay focused and pay attention to the fact that I've been coming here for about a month. The series of medication that he showed you were medication that I was prescribed by medical doctors over the past 7 months prior to meeting Dr. Kayla. And just to give you a brief synopsis of what I was going through for the past 7 months before coming here, I remember about 6 months ago I fell in the bathtub, and maybe 3 weeks after that I started to experience some horrible symptoms. I felt so off, excuse me, imbalanced. They said maybe it was vertigo. Maybe I was suffering with migraine headaches. I was having headaches, dizziness, feeling like I was going to black out, I was going to faint, panic attack, anxiety, pain in my left ear, right here, and around this area as well. And they said maybe it was an ear infection. I mean, I heard it all. And actually every single one of the tests that I took, from brain scan, which is a CT scan, to heart test, lung test, I just did some extensive tests, and every single one of them came back normal. And what the doctors did at that point was just prescribe me medication to take care of my symptoms, which were very horrible symptoms to go through, for someone to go through. Never got to the root of the underlying issue on what was really going on with me. I thought I was crazy. I thought I was losing my mind. I remember several times calling the ENT because it was horrible. And I remember one of the ENT specialists was saying, your heart is better, it looks better than mine. And I'm thinking, that what is going on with me? I think I'm going crazy. And I think they actually summed it up to that as well, because Valium was something that I was given as well. For those of you that know what Valium is for, it's also a muscle relaxer, but it's for anxiety and panic attacks. And one point in my life, I just didn't know what was going on. I was asking God, what is going on with me? Until one day, and this was November, the Christmas weekend, I went to our women's retreat, and one of the sisters came up to me, and she came actually in my room, and she said, Julie, I want you to go see someone. She didn't know about Dr. Kayla as yet. She actually found him, I think it's via internet, and when I came here, I saw this as a life-changing experience for me. I can tell you, in the month that Dr. Kayla has been treating me, that this side, the left side of my ear, and that pressure and pain that I was going through right here is totally gone. I don't feel like I have an ear infection. The dizziness has subsided tremendously. I've been seeing him for a month, and I'm still in treatment, and I'm actually looking forward to see the outcome of being here and being treated by Dr. Kayla, because there is a tremendous improvement, and we're still working. We're still working on it. Just so you know, before I actually came to Dr. Kayla, I stopped taking every single one of these medications. So for me, the process was a bit harder than maybe some of you, because of the medication. I just stopped. I stopped. I saw this as something that would probably take me out even before whatever the underlying issue was, because the side effects from this medication is horrible. And I remember one time I was sitting at my sister's house, and my nephew is a personal trainer. Excuse me. And he didn't know basically the details of what I was going through, but he just walked up to me one day and he said, Julie, you know how you feeling? You still having those headaches? And I said, yes. And he just looked at me and he said, Julie, do me a favor. Do not take any of those prescribed medications that those doctors are giving you.
Because you were taking some pretty heavy-duty stuff, right?
Yes, I was. And
Okay.
to cause a few of them, which is here, I have oxycodone or codeine. I don't know how you pronounce it, but for some of you, you may know how strong that is. Demerol is also another thing that I have in this stack of medication here. Sumatriptan, which is something they give for headaches. And and counting. Some of them I can't even pronounce, but some very serious medication here. And I just stopped.
Okay. Well, thank you, Julia, very much for sharing your testimony today. What would you say to people out there right now who find themselves in a position like yourself, who are just taking medication after medication, living a life like this? What would you say to them about exploring chiropractic or corrective chiropractic care?
I would say I would give it a thumbs up. At least try. At least try. Because I saw a series of doctors, and when it came back to just giving me and prescribing medications to me, I just didn't feel right about that. I didn't feel right about that. And one thing that I love about being here at Dr. Kayla's office is the fact that it's a corrective process. It's not, here you go, take this, and then you feel better for a few weeks or a few days or a few months, and then here we go again with the underlying issue. He's just opened up my eyes to a lot, and he's dealing with the underlying issue, finding out what's going on. And he was honest with me when I came here. He stated to me that he can help me, and I'm sure if he couldn't have helped me, he would have informed me of that as well. So I would say go for it. At least try. That's all you can do.
Okay. Well, thank you very much, Julia. We're going to go ahead and give her an adjustment now, and have a great day. Thank you.
Thank you. Bye-bye.